I'm Dr. Carleigh,
And I'm Dr. Hout.
and this is Real Talk with Holistic Docs.
Yeah, today we are talking about PCOS. As you know, what is the background of PCOS? Please tell us, Dr. Carleigh.
Yeah, so PCOS is really a multifactorial thing that's going on. So you've got hormones, you've got insulin resistance, and it's really one of these diseases that we don't fully understand yet, but as research is progressing, we're beginning to understand it more. It was thought initially that it was just the ovaries that were causing all of the issues, but now we understand that it's really more of an HPO axis dysfunction. So a lot of people are really familiar with the HPA axis dysfunction, which stands for hypothalamic pituitary adrenal. So this is slightly different, hypothalamic pituitary ovary, which is an interesting overlap to think about, the fact that you have these two systems that play together. And this is why when we talk about chronic stress, it's in the HPA axis, it's impossible to separate that from then ovarian and testicular function, because these things play together all the time.
Yep.
So this HPO axis dysfunction leads to menstrual irregularities, anovulation, which basically means you don't ovulate, and then another symptom that we call hyperandrogenism, which basically means you have too much testosterone. So what we now think is behind PCOS is you have an overproduction of something called luteinizing hormone within the pituitary gland. And that increased luteinizing hormone leads to high androgen production. So that's your testosterone and your DHEA. And you also have a low FSH, which is follicular stimulating hormone. Now, FSH is really important because it helps androgens to be changed to estrogen in women. It's a process called aromatization. So if these androgens aren't being changed to estrogen like they should be, then that means you have a whole bunch of androgens, all your testosterone and DHEA floating around in your system, and your body can't do anything about it. Another really interesting piece about this is you have this insulin resistance piece. And when you have a lot of insulin inside the body, what insulin actually does is it decreases your body's sex hormone binding globulin. And what sex hormone binding globulin does is it goes in and basically literally binds to the different sex hormones. So in healthy people, if they have slightly higher testosterone, that sex hormone binding globulin would be going in and binding to the testosterone. But because PCOS patients tend to have insulin resistance and this hyperinsulinemia picture, they cannot bind that free testosterone. So they end up with symptoms of this high androgen, which is like the facial hair typically. So it's hair on what we call the terminal points of the body, which means the chin and the nipples and sometimes below the umbilicus, below the belly button. And I know I'm trying to be better about not using doctor speak all the time.
Sorry.
All good. So there is some indication that there might be some genetic origins with PCOS, but that's still unclear. It does tend to run in families, but we don't know exactly what's responsible for it. So signs and symptoms of PCOS. Number one, like I talked about, is the menstrual irregularities. So you either have oligomenorrhea, another big fancy medical word, which means that you have a cycle that's longer than 35 days, or you have less than 9 periods a year. The other thing that falls under this menstrual irregularities category is amenorrhea, which means no period for at least 6 months. We already talked about the hyperandrogenism. PCOS is incredibly common, or not PCOS, infertility, is very common with PCOS patients. And that's due to the fact that they're actually not ovulating, right? So ovulation means that an egg is being released from the ovary, and it takes that release to actually be able to fertilize that egg and have a baby. So if you're not ovulating, you can see how that would be a big problem, right?
Right, exactly.
Huge problem. And the other thing is PCOS patients have a much higher rate of miscarriage too. So even if they do get pregnant, it's harder to maintain that pregnancy. Obesity and metabolic syndrome is rampant within PCOS patients. Whether or not they are obese, they can still have metabolic syndrome, which
Right.
is an important thing to remember, not only for PCOS patients, but for the general public too.
Mhm.
Just because you are thin does not mean you are metabolically healthy.
Right.
So,
Exactly.
right.
Yeah.
So, an important thing to remember. Um, Diabetes, obviously, metabolic syndrome and obesity are precursors to diabetes. So PCOS patients are at a higher risk for that.
Mhm.
And sleep apnea too
Yeah.
is another thing that can be these patients that can be at risk for, or can be a sign of metabolic syndrome and some other underlying precursors to PCOS.
Nice. So that was awesome. Very thorough. How do we go about diagnosing PCOS? Because we need to know
Yeah.
how to do that.
Yeah, so first of all, it really kind of depends on which country you're in or which organization you're referring to. Within the US, we generally use the Rotterdam criteria, which is the presence of two of the three of those things that I mentioned. So the menstrual irregularities,
Yep.
the hyperandrogenism, and polycystic ovaries that are seen on an ultrasound.
Right.
But
Exactly.
another really important piece to think about too is you have to exclude all the other diagnoses that could possibly lead to hyperandrogenism, amenorrhea, or polycystic ovaries.
Yeah.
So, what type of things do you end up screening for if you're looking at PCOS in a patient? You
Oh
look at
man.
you.
Yeah.
I
Go
know there's so
ahead.
much to look at.
Yeah.
You're like, yeah, you got to
Tell
go in
us.
deep.
Yeah.
The thyroid is a big
Yes.
one.
Uh-huh.
So you have to look at thyroid. Like I mentioned earlier, the HPA axis and the HPO axis are
Mhm.
intertwined. So you have to look at adrenal disorders, which is things like congenital adrenal hyperplasia and Cushing syndrome. You have to obviously look at other things on the ovaries, so ovarian tumors.
Mhm.
There is also a condition called just polycystic ovaries,
Right. Yeah.
which has nothing to do with PCOS, ironically.
Right.
So polycystic ovaries can be another thing.
Yeah.
Um, that you can have drugs, certain drugs that induce PCOS or amenorrhea more specifically.
Yeah.
Steroid use, so things like hydrocortisone, as well as exogenous steroids like testosterone, DHEA.
Mhm.
And you may not be taking these things, but say you're married and you have a partner who's using a testosterone cream and he's
Yeah. I
not
get
washing his hands, or you're like, you're
Yeah.
somehow being exposed to that. That is another thing that can cause it as well.
Mm-hmm.
We also have to look at the pituitary gland. So you could have a condition called hyperprolactinemia. Prolactin is a hormone secreted by the pituitary, and that can cause amenorrhea as well.
Yep. Awesome. So basically, we do all that in our brains when we're trying to diagnose you with
Mhm.
whatever
That's
it
the
is that's
process
going
that a
on.
doctor goes through. What are
Yeah.
all the possible things that could be causing this? So if we ever
Yes.
think we're just kind of staring off into space, that's why.
We're going through everything. So we talked about what it is, how we diagnose it. Why do we care about PCOS?
Yeah.
Let's
Well,
do
I
it.
mean, first and foremost, honestly, pregnancy is one of the main reasons why PCOS patients end up seeking naturopathic care,
Yep.
because the infertility issue is so huge.
Yep.
And so many women, really honestly, they come to me because they're like, I just want to have another baby.
Mhm.
And please help me to do that and have a healthy pregnancy when my
Mhm.
baby is born without any sort of congenital issues. So babies born to moms with PCOS actually have higher incidence of morbidity, which basically means that they're sick when they're born.
Mhm.
We already mentioned the higher risk of miscarriage and the infertility. And then moms who have PCOS and are able to maintain a pregnancy are actually at a higher risk of gestational diabetes and preeclampsia as well, which
Yep.
are big deal
Yep.
disorders, and it affects mom and baby, obviously.
Mhm.
So another reason that you really want to pay attention to PCOS, why this matters, is the increased risk of the insulin resistance,
Mhm.
hyperinsulinemia, which just means high blood insulin, the metabolic syndrome, diabetes. All of these things really put you at risk for big deal disorders down the line, like heart
Yep.
attack and stroke.
Yep.
These are huge chronic diseases that cost the United States trillions of dollars every single year. and they all have their origins within this metabolic syndrome, hyperinsulinemia space.
Right.
So PCOS patients need to pay attention to that, because that is one of the keynotes in their diagnosis, is this insulin resistance.
Right.
So why does high insulin resistance matter? So like I mentioned, it decreases that sex hormone binding globulin. It increases the way that ovaries, it changes the way that ovaries release their hormones. So obviously that makes sense why PCOS is involved with that.
Yep.
It leads to abnormal lipids in the blood. So the HDL, the LDL, the triglycerides, and it's associated with a lower level of a hormone called adiponectin, which regulates fat metabolism in the body, and it also regulates glucose levels.
Yep.
So all of this together puts you at a really high risk for things like clots inside of your blood, strokes, and cardiovascular disease.
That's right.
A big deal.
Yeah.
Really big deal.
Huge deal.
Yes, exactly. And if you believe in preventative medicine at all, treating that insulin resistance and hyperinsulinemia is so important for that reason right there. Another reason that treating PCOS at a root cause level really matters is that PCOS patients have an increased risk of something called endometrial hyperplasia and endometrial carcinoma. So those are a bunch of big fancy words, but basically what it means is your uterus grows tissue more than it normally would. And because of the fact that you don't have the normal monthly cycle, that tissue doesn't get the chance to be released through the body. That's why women have a monthly cycle, is because if that tissue is not released, it can actually turn into cancer.
Yep.
So PCOS women, because they have less menstrual cycles, do not or at a higher risk of carcinoma because of that. And this is why that conventional doctors use oral contraceptives, because they're trying to get that withdrawal bleeding that happens during that placebo pill phase of it. And that specifically is to reduce that risk of the carcinomas. So that's in a nutshell why you should care about PCOS.
Yeah. So speaking of conventional doctors, what do conventional doctors do to treat PCOS? You mentioned birth control pill.
So birth control pill is one of the first things that a PCOS patient will be put on, as well as metformin. So those two things together are designed to treat that hyperandrogenism, so the high testosterone and DHEA, and the insulin resistance together. If the patient is struggling with infertility issues, they'll typically use a drug called clomiphene. And then I thought this was really interesting in my research looking into this. I thought it was fascinating that they mentioned that there's more research needed on the specific role of weight loss in PCOS. And just knowing what we know as naturopathic doctors, that weight loss is so closely tied with improving insulin sensitivity, and that obesity is a risk factor for so many things, that just blew my mind that that's not like forefront. Like, weight loss is important. We don't need research. We have years and years and years of basically clinical evidence that shows that weight loss really matters.
Yes. Oh my gosh. I can't believe that was something that you read.
Yeah, isn't that interesting?
Yeah.
Yeah.
Oh my gosh. Okay. Anyway, continue. Clomiphene, weight loss. Oh, what do they recommend for weight loss? Did you read anything on that?
Yeah. So when they do recommend it, they basically just say you need to lose 10% of your weight. There's no
eye roll.
There's no talk about how.
Right.
There's no talk about the use of healthy diet, about movement. It's just lose 10% of your weight. So it's no wonder that people are frustrated and confused about how to make that happen.
Yeah. So segueing into what we do as naturopathic doctors for the treatment of PCOS.
Yeah. So first and foremost, I consider regulating the circadian rhythm.
Yes.
Which may sound kind of weird because circadian rhythm basically means sleep, right? But we don't really understand how influential sleep and having this daily night-day rhythm is on our hormones and our neurotransmitters. So cortisol, insulin, adiponectin, and glucose, all things that I've talked about during the course of this discussion, they're all regulated by peripheral body clocks that you have, which are set up by something called the suprachiasmatic nucleus, which is basically a piece of your brain that sits right above your eyes and responds to light and dark.
Yep.
And so it's that contrast of light and dark that allows the suprachiasmatic nucleus to regulate these clocks in your body. And if that gets messed up, then the regulation of all of these hormones is messed up.
Yep, that's so important. That is the foundation of how everything in your body runs. So I love that you mentioned that. Yep.
Another thing is going to be supporting that HPO axis / HPA axis, right? So the hypothalamic, pituitary, ovarian, and adrenal axis. A lot of naturopathic doctors do this with adaptogens. I would caution people because as adaptogens are becoming more popular in pop culture, basically, people are just kind of taking them and not realizing that each of them have very different effects inside of your body. And one called ashwagandha, which is actually very popular, it's gotten a lot of press recently, it can actually have testosterone-like effects. So if you have a PCOS patient, you don't want to give them ashwagandha because that could potentially and again, if you don't have a degree in herbalism or naturopathic medicine, please do not just start taking things.
Yes, please.
It's just a bad idea. Like you wouldn't just start taking a pharmaceutical drug.
Right.
So do the same thing with herbs and supplements.
Thank you. Thank you for saying that. Yes.
We'll have another discussion about that sometime.
Yeah, right.
All right. So another thing that we look at is regulating the blood sugar.
Of course.
Right?
Duh.
It's super important. So most of that can be done with diet. So obviously you're going to be eating a whole foods diet. You're going to be decreasing the amount of processed carbohydrates, simple sugars, things like that. That's a quick, easy way to regulate the blood sugar. Another thing that you can do, dietarily speaking, is to help relate that circadian rhythm with your diet.
Yes.
And so actually what you need to be doing, so a lot of people, intermittent fasting has become really popular for PCOS patients, and I think that it's great, but you should actually be doing it the opposite way that most people do it, which is, so most people fast in the morning and then eat a bunch of calories in the later half of the day. What you should be doing is eating the majority of your calories in the beginning of the day and very light at the evening.
Thank you.
And this is because insulin sensitivity and glucose tolerance are the best in the morning. And actually, when you eat late at night, it decreases your body's ability to make melatonin. So people who are doing this late night snacking thing or eating, 2 to 3 hours before bedtime are actually impairing their body's ability to make the hormone that helps you to sleep.
Yep.
So that's a really important thing to remember, again, for everyone. For everyone.
Yep.
Another important thing for PCOS patients dietarily, high protein, low carb, right? Obviously for the insulin resistance piece of things. And then there's a supplement called D-chiroinositol, which can help as well. And interestingly enough, it also helps with anxiety too. So
cool.
Yes. Another consideration for our patients is reducing risk, right? So the cardiovascular disease, diabetes, and stroke that we talked about, they're huge, huge risks. So the weight loss piece that we talked about that's really important, regulating the blood sugar, normalizing those lipids. And I love putting my PCOS patients on strength training programs because so many of them are doing like 4 to 5 times a week of high intensity interval training, low steady state cardio and things like that.
Yeah.
You guys, it's fine to do that a couple days a week, but the bread and butter of your exercise program should be strength training. And we can go into that another time about why putting on muscle mass is so important, not only for hormonal regulation and for PCOS patients, but for longevity reasons as well.
Yes. Overall, excellent. Exercise.
Yes. And so last but not least, we also want to help our patients at a symptomatic level too. So reducing some of those androgens that are in the blood. So the testosterone, DHEA. And we can do that with very specific herbs and nutrients. Some of those are saw palmetto, nettles, green tea, and licorice. And it's really awesome what nature has given us to use and the specific actions that it has. And, these are just fantastic tools that naturopathic doctors are trained in, better than any other profession out there. So that's that in a nutshell is how NDs look at PCOS.
Awesome. Is there anything else that you want to say about PCOS or anything that you talked about? Anything you want to emphasize?
I would say, so all of my patients with PCOS, the thing that I do is run a Dutch test on them.
Yep. Okay.
If they're on an oral contraceptive, so I prefer to do the cycle mapping test, which basically gives me a daily look at what their hormones look at day by day, each day of the cycle. But
Nice.
if you're on an oral contraceptive, you can't do that.
Yeah.
Because of the fact that you're
It's
on
not.
you're basically,
Yeah.
your hormones are being regulated by that contraceptive. So I do the Dutch complete test, which is great too, because it also gives me like a snapshot into your hormones. And it also looks at cortisol as well, which is fantastic. So I think that my message for anyone with PCOS is that there is help out there, and you can get more pointed recommendations to not only regulate at a symptomatic level, but hopefully help to reverse some of these issues that come from PCOS.
Yes.
And look for someone who's trained and understands how to do that. And the other thing is too, is as like I mentioned earlier, don't start just taking stuff.
Please
Just because we just mentioned it here, please do not go run out to Sprouts and buy it, because your physiology is unique to you,
don't.
and you need to be taking things that are going to help you, not
Yes.
just everyone. The stuff that we list off here is like bullet points of things that we would consider, but may not necessarily be right for you.
Right. Every person has so many other things going on too, maybe not just PCOS. So we have to look at the entire picture, and it's just totally personalized.
Exactly.
Good. So want to tell people where they can find you, please?
Yes, I am Dr. Carleigh Golightly, and you can find me on Instagram as at Dr. Carleigh Golightly, or online at empowermedclinic.com.
Awesome. And that is in San Diego, California.
San Diego, California.
Sunny San Diego. I am in beautiful sunny New Jersey. Today it's sunny. I'm Dr. Hout, and you can find me at holisticdrhoot.com. Also, Holistic Dr. Hout all over social media. And that is our show for today.
Thanks, everyone. We'll see you next week.
Bye.